Breast cancer. Why Black women have higher mortality rates. Introduction. Breast cancer is one of the most common cancers affecting women globally, but Black women have significantly higher mortality rates than their white counterparts. This disparity is due to a combination of biological, social, economic, and healthcare-related factors. This lecture will explore the reasons behind these higher mortality rates, discuss prevention strategies, treatment options, and provide guidance on how women in both America and Africa can take proactive steps to reduce their risk of developing breast cancer. Breast cancer remains one of the most prevalent cancers affecting women globally. However, Black women in the United States and other parts of the world face significant disparities in diagnosis, treatment, and survival outcomes. This document explores the causes behind these disparities, prevention strategies, treatment options, community advocacy efforts, and potential advancements toward a cure. Understanding breast cancer. Breast cancer occurs when cells in the breast grow uncontrollably. These malignant cells can form tumors, invade nearby tissues, and spread to other parts of the body. Early detection and treatment significantly increase survival rates, but disparities in healthcare access and awareness mean that many Black women are diagnosed at later, more advanced stages. Why do Black women have higher mortality rates? 1. Late-stage diagnosis. Many Black women are diagnosed at later stages, reducing the effectiveness of treatment. Aggressive cancer. Subtypes. Black women are more likely to develop triple-negative breast cancer, which is more aggressive and harder to treat. Healthcare access and bias. Many Black women face barriers to quality healthcare, including financial constraints, lack of health insurance, and systemic medical racism. Genetic and biological factors. Studies show that genetic variations contribute to the increased risk and aggressive nature of breast cancer in Black women. Participation in clinical trials. Black women are underrepresented in breast cancer research, leading to treatments that may not be optimized for them. Cure and treatment options. Surgery. Depending on the stage, a lumpectomy or mastectomy may be performed to remove cancerous tissue. Chemotherapy and radiation therapy. These treatments help destroy cancer cells and prevent recurrence. Hormone therapy, effective for hormone receptor-positive breast cancers, reducing the chance of cancer returning. Immunotherapy and targeted therapy. New treatments such as monoclonal antibodies and immune checkpoint inhibitors are being developed to improve outcomes for aggressive cancer types. Prevention strategies. Regular screenings. Early detection through mammograms and self-examinations improves survival rates. Healthy diet and exercise. Maintaining a balanced diet and regular physical activity reduces the risk of cancer. Reducing alcohol and tobacco use. Avoiding smoking and excessive alcohol consumption lowers the risk of breast cancer. Genetic testing and counseling. Women with a family history of breast cancer should consider genetic testing to assess their risk. Advocating for better health care. Black women should demand equitable healthcare services and participate in breast cancer awareness initiatives. How to avoid breast cancer routine. Health checkups. Regular doctor visits help detect abnormalities early. Breastfeeding. Studies suggest that breastfeeding reduces the risk of breast cancer in women. Managing stress. High stress levels can weaken the immune system, making the body more susceptible to diseases, including cancer. Avoiding hormonal disruptors, limiting exposure to chemicals in cosmetics, plastics, and processed foods that may contain endocrine disruptors. Advice to women in large communities in America and Africa. Community awareness campaigns. Women should engage in advocacy, community discussions, and education programs. Support groups and counseling. Creating and joining support networks can help women cope with breast cancer diagnoses and treatment. Government and NGO involvement. lobbying for better healthcare infrastructure and affordable screenings in both America and Africa. Traditional and modern medicine integration, educating communities on the benefits of combining traditional medicine with modern cancer treatments, biological and genetic factors, higher incidence of triple-negative breast cancer, TNBC, an aggressive subtype. Genetic mutations such as BRCA1 and BRCA2 and their prevalence among Black women, the role of epigenetics and environmental influences on gene expression, socioeconomic and healthcare barriers, limited access to high-quality healthcare and specialists, financial burdens leading to delayed diagnosis and treatment, uninsured or underinsured status affecting medical decision-making, cultural and social determinants of health, medical mistrust stemming from historical injustices, lack of representation in clinical trials affecting treatment outcomes, disparities in patient-provider communication and implicit biases in healthcare, prevention strategies, early detection and screening importance of regular mammograms and self-examinations, disparities in screening rates and barriers to early detection, access to mobile mammography units and community screening programs, lifestyle modifications, diet and nutrition, role of plant-based diets, anti-inflammatory foods, and balanced nutrition, physical activity, exercise recommendations to reduce cancer risk, avoiding harmful exposures, environmental toxins, endocrine disruptors, and alcohol consumption, genetic counseling and risk assessment, the importance of genetic screening for high-risk individuals, family history considerations and its impact on prevention strategies, availability of genetic counseling services in underserved communities, treatment disparities, and solutions access to standard care differences in treatment options offered to Black women versus other racial groups, challenges in accessing advanced therapies, including immunotherapy and targeted treatments, the impact of hospital quality and location on treatment outcomes, clinical trials and research inclusion, underrepresentation of Black women in breast cancer research, efforts to increase diversity in clinical trials, the role of personalized medicine in improving treatment efficacy, psychosocial and supportive care, addressing mental health challenges during cancer treatment, the importance of culturally competent support groups and patient navigators, role of faith-based and community organizations in emotional and spiritual support, community advocacy and policy changes, grassroots and nonprofit efforts, role of Black-led organizations in raising awareness and providing resources, community-driven initiatives to bridge the healthcare gap, collaboration between researchers, activists, and policymakers, health policy and legislative actions, the impact of the Affordable Care Act on cancer care access, advocacy for federal funding toward breast cancer research specific to Black women, policies aimed at reducing systemic racism in healthcare institutions, media and education campaigns, importance of culturally relevant breast cancer awareness campaigns, leveraging social media, influencers, and survivors' stories, educational programs tailored for Black women and their unique health advancements toward a cure and future directions, innovations in breast cancer treatment, precision medicine, and the development of targeted therapies, the role of artificial intelligence in early detection and personalized treatment plans, advances in immunotherapy and their effectiveness in triple-negative breast cancer cases, holistic and integrative approaches, the role of complementary therapies such as acupuncture, meditation, and herbal medicine, addressing social and emotional well-being through holistic care, collaboration between conventional and alternative medicine practitioners, future research and breakthroughs, the potential of CRISPR and gene editing in cancer treatment, new drugs in development and their promise for high-risk patients, The role of advocacy in securing funding for research focused on Black women's health. Conclusion. Breast cancer remains a significant health threat to Black women, but with education, early detection, and equitable access to health care, mortality rates can be reduced. Every woman has a role in fighting this disease through awareness, lifestyle changes, and advocacy for better healthcare policies. By taking these steps, women in both America and Africa can improve their health outcomes and create a future where breast cancer no longer disproportionately affects Black women. Addressing breast cancer disparities among Black women requires a multifaceted approach involving medical advancements, policy reforms, cultural competency in healthcare, and community-driven advocacy. By increasing awareness, improving access to care, and promoting equitable research, we can work toward reducing mortality rates and improving the quality of life for Black women diagnosed with breast cancer. Call to action: individuals, healthcare professionals, and policymakers must collaborate to dismantle barriers, promote early detection, and support ongoing research efforts to find a cure for breast cancer. Community engagement and advocacy remain key components in ensuring equity in breast cancer care for all women. And prostate enlargement. Why Black men have higher mortality rates. Introduction. Prostate cancer and prostate enlargement are two of the most prevalent health concerns affecting men worldwide. Among these, Black men face disproportionately higher mortality rates due to a combination of genetic, socioeconomic, and healthcare-related factors. In this lecture, we will explore the causes behind these disparities, discuss treatment options, preventive measures, and provide guidance on how men in both America and Africa can take proactive steps to reduce their risk of developing prostate conditions. Understanding prostate cancer and prostate enlargement. The prostate is a small, walnut-sized gland in men that plays a crucial role in the reproductive system. Prostate cancer occurs when cells in the prostate grow uncontrollably, forming malignant tumors. Prostate enlargement, or benign prostatic hyperplasia, BPH, is a non-cancerous enlargement of the prostate that affects urinary function but does not spread like cancer. Why do Black men have higher mortality rates? Genetic predisposition. Research suggests that genetic factors make Black men more susceptible to aggressive forms of prostate cancer. Late diagnosis. Many Black men are diagnosed at more advanced stages when treatment is less effective. Healthcare access and disparities, economic constraints, lack of insurance, and systemic medical biases contribute to poorer outcomes. Limited awareness and screening. Cultural and social factors may lead to lower screening rates, delaying early detection. Underrepresentation in research. Black men are often underrepresented in clinical trials, which limits knowledge of the best treatment options for this population. Cure and treatment options. 1. Surgery, prostatectomy. The removal of the prostate gland may be necessary for localized prostate cancer. Radiation therapy. High-energy rays or particles target cancer cells, either externally or internally. Hormone therapy, also known as androgen deprivation therapy, ADT. This treatment reduces male hormones that fuel prostate cancer growth. Chemotherapy, used in advanced prostate cancer cases when other treatments are no longer effective. Active surveillance. In cases of slow-growing cancer, doctors may recommend monitoring rather than immediate treatment. Medications for prostate enlargement, drugs like alpha blockers and 5-alpha reductase inhibitors help manage BPH symptoms. Prevention strategies. Regular screenings. Routine. PSA, prostate-specific antigen. Tests and digital rectal exams. DRE, can detect prostate issues early. Healthy diet. A diet rich in vegetables, fruits, lean proteins, and healthy fats can lower prostate cancer. Risk. Regular exercise. Physical activity helps regulate hormones and improve overall health. Maintaining a healthy weight. Obesity is linked to a higher risk of aggressive prostate cancer. Reducing alcohol and tobacco use. Limiting these substances can decrease cancer risk. Managing stress and mental health is one of the leading causes of preventable immune system and including lung cancer, heart disease, and respiratory illnesses. Prostate cancer and prostate damages nearly every organ in the body and reduces overall life expectancy. Annual health screenings, quitting smoking or never starting early, significantly limiting red meat and dairy intake. High consumption of animal fats has been linked nicotine to replacement therapies or medications. Consuming more lycopene-rich. It's never too late to quit. Your body begins to heal almost immediately after you stop smoking. Other red fruits maintain lycopene, a healthy weight, which may reduce prostate cancer risk. Maintaining a healthy weight is crucial. Increasing for selenium and vitamin D like intake. Diabetes, heart These nutrients play a role in prostate health. Excess staying hydrated, the body and proper hydration supports urinary and prostate function, and regular engaging in safe sexual activity. Frequent ejaculation has been suggested to lower prostate cancer risk. And mindful eating advice to men in large communities in America and Africa. Exercise. Community awareness programs. Regularly. Educating men about prostate health through workshops and public discussions. Muscles and boosts encouraging open conversations. Aim for at least overcoming stigma related to prostate health discussions in cultural settings. Advocacy for better healthcare access. Promoting policies that improve healthcare affordability and quality. And helps support groups and counseling, providing emotional and psychological support to men diagnosed with prostate conditions. Traditional and modern medicine. Eat a healthy diet. A healthy diet rich in fruits, vegetables, educating communities on combining traditional practices with modern medical advancements. Limit processed foods, conclusion, added sugars, and saturated prostate cancer and prostate enlargement are serious health concerns that disproportionately affect Black men. And reduces the risk of chronic However, diseases. Through education, early detection, lifestyle changes, and advocacy for equitable healthcare, mortality rates can be reduced. Can lead to liver disease, every man has a role to play in protecting his health. If you choose to by seeking regular checkups, making healthier lifestyle choices, and engaging in open conversations about prostate health. By taking these proactive steps, men in both America and Africa can improve their health outcomes and work towards a future where prostate cancer no longer exists. Skin cancer and premature aging. Use broad-spectrum sunscreen with SPF 30 or higher, wear protective clothing, and seek shade during peak sunlight hours, 10 a.m. to 4 p.m. Avoid tanning beds, as they also emit harmful UV rays. Regular skin checks can help detect abnormalities early. Protect yourself from infections. Prevent infections by practicing good hygiene, such as washing hands frequently, cooking food thoroughly, and avoiding close contact with sick individuals. Stay up to date on vaccinations, including flu and COVID-19 shots. Use protection during sexual activity and avoid sharing personal items like razors or needles to reduce the risk of infectious diseases. Get screening tests regularly. Regular health screenings can detect diseases like cancer, diabetes, and heart conditions early, when they are most treatable. Follow your doctor's recommendations for tests such as mammograms, colonoscopies, blood pressure checks, and cholesterol screenings. Early detection saves lives and improves outcomes, so prioritize preventive care as part of your health routine.